Hi, this is Greg Kilstrom. Welcome to Season 3 of the Agile World, where we discuss customer and employee experience, organizational and workforce transformation, and how business can adapt and continually improve in an agile age. The Agile World podcast is brought to you by TEKsystems, an industry leader in full-stack technology services, talent services, and real-world application. For more information, go to teksystems.com. To read more about the topics discussed in this show, you can go to my website at theagile.world and read my latest articles, or get a copy of my latest book, The Agile Workforce, now available on Amazon and other retailers. My name is Greg Kilstrom, and I'm the host of the Agile World podcast. Today we're going to talk about leadership, employee, and patient experience in the healthcare space, and how the healthcare space poses unique challenges and opportunities in these areas. To help me discuss this topic, I'd like to welcome Tracy Courtney, Director of UPMC Experience and Project Management at UPMC International Training Site. Tracy, welcome to the show.
Thank you, Greg, for having me today.
Yeah, absolutely. Looking forward to talking with you about these important topics. So let's get started by talking a little bit about your current role at UPMC. So just to introduce everything, why don't you give a little background on what UPMC is, what you do there, and just where UPMC, how it differentiates itself in the space.
Well, UPMC is a world-class healthcare system. We have domestic hospitals and spaces in New York, Western Maryland, and in Pennsylvania. And additionally, we are have a presence in Ireland, Italy, and starting in China in 2023. But we're a healthcare system that provides quality care. Our mission is to provide patient experience that is world-class, employee engagement, and leadership development. My piece in UPMC, my role is I'm the director of UPMC Experience and Project Management for the International Division. I'm also involved domestically, as well as providing support for what we call the UPMC Experience. And the UPMC Experience is all about leadership development, employee engagement, and patient satisfaction. So that is our mission, and that is my charge in what I'm doing in taking the UPMC Experience to our international sites in Ireland and Italy, and then eventually in China.
And what was the path that you took in your career to get to this position? From talking with you earlier, I know you didn't start out in patient experience per se, but what kind of led you to this path?
Well, my career path is not the norm. I was in education for 25 years. I was a classroom teacher. And then I decided to leave the classroom, not because I did not love my job or love education, but I always had a personal goal that I wanted to make a bigger difference with the skill set that I had. So then I took the leap from public and private education, and I went into corporate education and worked for a publishing company. And I was the manager of professional learning. And in that role, I supported account executives. I met with stakeholders. I had 20 employees, consultants that I managed. I also did presentations at certain conferences that were, I wouldn't say international, but domestically, just speaking on what I did in my position, because I was identified as one of the top leaders as far as the Mid-Atlantic region. So from that point on, I decided that I wanted to jump into healthcare. And because I noticed there was such a similarity between what I actually have been doing all my life with educating children and then educating adults and then developing my business acumen, I took the leap and I applied for the job that I did with UPMC. And I was fortunate enough to get that job, and here I am today. So what I've done, if you look on my resume, it looks like, oh my goodness, she went from education to healthcare. But actually, as we spoke before, there's a lot of alignment, believe it or not, as far as just educating people and making sure that you do it in a professional way that can help for the greater good.
Yeah, I love that, and I agree. I mean, it's always interesting to me how people kind of find their way into these related areas, and I agree with you. I think the education component is can be very relevant. And so let's talk then about the healthcare industry and patient experience. And what do you think are the biggest challenges in providing great patient experience that are specific to healthcare?
I thought a lot about this question as far as what do I feel is the greatest challenge. Patient experience is not something that is difficult. It's really going back to the basics of providing kindness and really providing communication. And there's key strategies and behaviors that best practices that I teach and I support to be able to provide that patient experience. But one thing that I know that is a challenge in the healthcare space right now is the shortage of healthcare workers. And that's difficult because what happens then, nurse to patient ratio is normal, it's higher than what it normally is. Um, Retention is difficult because of the pandemic. So, right now, I know that is a challenge. I can speak on UPMC's behalf as far as they are dedicated and determined that this does not impact their patient care. So, but I know, you know, uh, throughout the United States, this is a challenge. But I'm happy to be a part of UPMC and knowing that they're so committed in making sure that this challenge is not impacting their care. But I do have a personal story I'd like to share though.
Sure, yeah, please do.
So about a week ago, I had to experience patient care myself through my daughter. And I had to go into a local hospital that is not a UPMC hospital. And it was very difficult for me because I was trying to just put on my mom cap and not my professional cap. But I walked into the ER and I had no idea what room my daughter was in. And I had asked a nurse, and she pointed and told me, go around this corner, make a left, make a right, make a right. And first thing in my mind is what we follow is we escort, we don't direct. Something very simple. Because when you're in the hospital, you have anxiety, especially the ER, because you're there for a reason, something unexpected happened. So that
Yeah.
was the first thing. At UPMC, if you are lost or need to a room, you're escorted, you're not directed. So then I finally found my daughter and I walked in, and it was during a shift change. And something that I'm one of the best practices is bedside shift. And that's just communication with the patient, the nurse that was um, on duty, and carrying over the care to the nurse that's coming onto duty. I did not see the bedside shift. I barely got communication as the mom. I had to ask questions. There was not what we call a white communication board. I just saw and I appreciated the strategies that we use and best practices. The communication was just not there. Um, and then my daughter had to use the call button, and we waited, and it was 10 minutes before anyone came. And so again, that's something that's, really just not acceptable. And that's all little things that make a difference in a patient's experience. Um, as we left, it was just lack of communication. I could tell that the nurse did not fill the doctor in when they came in to discharge her. So I go back to saying, I saw this personally. It was
Yeah.
difficult, but these are just simple best practices that you can use that you make the patient experience one that gives you quality patient care and wait time, simple things like that, and communicating your wait time. So it really made me reflect on all the work that we do at UPMC and being thankful that we are doing that for our patients and the quality of care that we give.
Well, so as a comparison, then you mentioned a couple things that might have some metrics associated with it, but how
Right.
do you measure success in your efforts?
Well, we have different surveys. We use what's called My Voice, which is an employee engagement survey. And then we also have HCAP, the HCAP surveys that go out to patients. That's closely monitored, and we really focus our efforts on where our strengths are and our weaknesses are, and we use the data to be able to grow from that. And each hospital is different, so it's not a one size fits all, but we use the actual data to be able to drive our results. So, and we do different things, aura surveys, different surveys that are that give us that information to know if we're reaching success to what our goals are yearly.
What I've seen and I know when we talked before the show, we talked about this a little bit as well, is leadership buy-in is so key to making change happen and keeping change continuing to happen and things like that. How have you successfully gotten leadership buy-in for your efforts, and do you agree in the importance of that?
First of all, I do agree 100%. I've personally experienced it working with the domestic leaders and the leadership and what they've accomplished since they've instituted the UPMC experience, which was 3.5 years ago. And we're successful. And the reason why we're successful is because we have such strong leadership, and the leadership and the charge from the top, so to speak, below is so important because you are showing support and that you have a buy-in into the program, and that's why it's been successful domestically. Now, for us to do the buy-in internationally, we have my team. We've had to show the value and what we're doing, and showing the results of the success of what we've been doing domestically. Now, it will look differently internationally, and there are challenges with language, cultural differences that we have to keep in mind. This has never been done before, what we're going to be doing. And so we're working through the kinks, but there are differences. But the leadership, the executive team has 100% buy in, and they're very excited about bringing this project to their hospitals. And showing the value was probably key, and the work that we have done. We're fortunate that we can show the work that we've done domestically. So that also helped. Um, it's just so important to the leadership to understand the best practices, the key behaviors, and to demonstrate those. And it's proven to show success.
When you're proving the value to the leaders, are you using those metrics of success you mentioned earlier? Are there other things that they're looking for? I know there's a lot of people out there struggling with demonstrating success so they can either get continued investment, continued buy-in, and all that. So anything else that you could share that might be helpful with others in a similar space as you would be wonderful.
Some of the surveys that we will be using internationally, well, for example, HCAP scores, that they're not used internationally. That's just something that's in the United States.
Yeah.
And that's HCAP scores is actually derived from our government, and it's linked to Medicaid and Medicare resources and funding. So, but it's a very strong metrics that we do use in the United States to measure the quality of care for our hospitals. But internationally, we have to use different matrix. We're actually developing those as we continue to move forward with the project. So we will have to customize what we feel we need to do to be able to show success. They do have certain surveys already in place, and we'll be using some of those as well with the data. So it's really important to be able to have that metrics to show the level of success. And one thing that is so important, and I think this is another um, buy-in that the leaders really liked, is that what we do is we really validate. And we do that in every level with rounding, with employees and leaders. And there's constant validation. And that's another way to show success. It's another way to monitor progress, the validation tools, and also to give feedback to the employees. So, we have a lot of different tools that we use just beyond the data, because everybody knows the data is there, but there's always a story behind it as well.
Yeah.
So
Yeah.
it's not the only tool that we use to measure success.
As far as the international expansion, because I think this is it's a really interesting component of what you're doing. It sounds like you've started with leadership first, as getting their buy-in as well. What have there been any? I know there's different privacy issues over there with GDPR and other things like that versus HIPAA here and things. Have you run into any other um, unforeseen things or anything like that? And how has working with leadership first kind of helped mitigate some things that might have been challenges?
Working with the leadership and training the leaders in the program that we're doing is essential, because they have to understand it first to be able to cascade it to the employees of the hospital. So we decided to start with the executive leadership. And like I said, it's just important that they understand um, their role and what they need to do to be able to implement this program and to be successful. So that's why we decided to start with leadership development first. These are strong leaders as well. But what we're doing is we're teaching them best practices in what we need to do to improve employee engagement and patient experience. So that's why we decided to start with leadership development. As far as challenges, we did fall into some privacy challenges, but we were able to overcome them. So, other than we have to always be mindful of the cultural differences and be mindful of language and translation.
Yeah.
So, those are two key points that we'll continue to work through. We do have translators and interpreters in Italy to help us with the language. We have to be mindful that the language that we use, the printables, deliverables, um, have to be translated into the right language so the content's not missing. So, it's just an interesting piece, and something that we just have to consider at all times. And then culturally, their executive team, their leader roles are different. A physician in Italy is called a consultant.
Mm.
So, it's just there's just the cultural
Yeah.
differences that you always have to be mindful of. But we're doing it. We have the support of the executive team. We have great support internationally, with the leaders in our international team. So um, I see we're determined to be successful. So
Good.
and any challenges that may come up, we always seems to work through them.
One last question before we wrap up. You've mentioned a couple times as we've been talking here about both employee experience as well as the patient experience. I'm a strong believer that the two are related and very directly related. Sometimes you can move the needle on one without the other, but they're always related, and at least in some way. As you're working with leaders, whether that's domestic or international, is that a concept that you find yourself needing to teach, or is it more helping them understand how to make that connection more valuable or make strategic improvements to it or something like that?
I feel that it's just not something that I have to teach. It's more of showing the value and how they
Yeah.
are strongly connected. I agree with you, because if you have a happy employee, your experience is probably going to be happier for the patient.
Right.
So I believe they're key, and I know that that's just something that we believe in, and that's our value. Um, an experience would not be good if a nurse would say, "Well, we believe in managing up, not managing down." So if
Yeah.
you're going to radiology and you want to manage up the radiologist or the technician. So that's what we believe in. And I believe that does help. And it is so tied to patient experience. And I think that's why we're successful at UPMC.
Tracy, thanks so much for joining the show. For those listening, what's the best way for them to keep up with what you're doing?
LinkedIn. My LinkedIn profile would probably be the best way.
Wonderful. Well, again, I'd like to thank Tracy Courtney, Director of UPMC Experience and Project Management at UPMC International Training Site, for joining the show. Thanks for listening to The Agile World with Greg Kihlstrom. See you next week. Thanks again for listening to the Agile World podcast, brought to you by Tech Systems. I'm your host, Greg Kihlstrom. If you enjoyed the show, please take a minute to subscribe on your podcast channel of choice and leave us a rating so that others can find the show more easily. You can learn more and get a copy of my latest book, The Agile Workforce, from my website at theagile.world.